right, my name is Patrick Schnurr. I am a P1 pharmacy student at the University of Charleston School of Pharmacy. Today I'm going to talk to you about emotional intelligence, or EQ, which, as defined by Psychology Today, is emotional awareness, including the ability to identify your own emotions and those of others, the ability to harness emotions and apply them to tasks like thinking and problem solving, or the ability to manage emotions, including the ability to regulate your own emotions and the ability to cheer up or calm down another person. It's also clarified as the measurement of one's ability to perceive, understand, and manage emotions of both themselves and others to become more compassionate, productive, and understanding. Emotional intelligence, or EQ, can help improve a number of outcomes and situations. It can improve how an argument at work is handled, how someone interviews for a job, how someone deals with an upset customer, an upset patient, or even just how well someone does their job on a regular basis. It is not just IQ that matters, but EQ too, and it is an even larger part of the equation that is often ignored. So take a deep breath, and let's begin our talk about the different aspects that constitute emotional intelligence. There are 4 different skills associated with EQ that have to be maximized in order to use the concept to its fullest. They are: 1, perceiving emotions. Can you tell me what someone else is feeling? What does their face and body say? Are they angry, sad, or maybe just overwhelmed in their current situation? Asking these questions and practicing this skill will allow you to be able to develop the other 3 skills, as they are all dependent on knowing what the other person, as well as yourself, is feeling. Number 2, reasoning with emotions. This step involves using emotion to promote mindful thinking and to help prioritize what is most important. If we don't know how others feel about something or ourselves, how do we know what to do first to achieve the best outcomes possible? Number 3 is understanding emotions. Again, this skill ties into the first. And how can you understand another person if you do not know how they're actually feeling? To be successful, you must be able to interpret their emotions and determine the cause, especially if it is an emotion that is the cause of their problems, such as grief or anger. 4 would be managing emotions. This skill really ties together all the other 3 skills, in that you must know the other's feelings first, be able to reason their emotions and understand and be able to manage them and take action as needed. This applies to your own emotions as well. This skill also deals with regulating emotions or keeping them in check so that they do not overwhelm, as they are to do, i.e. blowing up at your boss if you don't get the promotion or if someone else takes the credit for your work. By increasing your emotional intelligence, you can greatly increase your performance both on the job and in your life in general. 1, this will help you improve your social skills. Managing your emotional intelligence, increasing your emotional intelligence will help you to improve your social skills. Will help you learn to manage conflict and controversy, as well as manage your own self and your own emotions. These all will help you become a great professional in your own right as you move up into your future role as either a healthcare professional or a pharmacist, specifically for us, pharmacists. Here are some examples for your consideration, which could also be construed as EQ case studies. A patient has just approached you ranting and raving that someone has given them the wrong medication. They want this corrected now, and they want the person responsible fired immediately. What do you do? And we can think about this. Ideally, you would try to get the patient to take a seat so that they could calm down and explain exactly what error they think was made regarding their medication. Then from there, you would want to determine whether an error was made, and if so, where was it made, why was it made, and how it could be corrected. And then you would assure the patient that it will never happen again. Someone without high emotional intelligence, or low EQ, may make this situation worse by inflaming, immolating, or deprecating the patient even more, and making the situation worse for all of those involved. Another example, or case study, would be you're the pharmacist filling in for a PIC at a local chain. The pharmacy is short-staffed already due to a budget cut, and you were just informed that one of the pharmacy technicians will not be showing up for a shift. The workflow has been moderate up until a patient approaches the drop-off window. The patient asks you for assistance. Under normal workflow situations, a technician would be fulfilling the drop-off station. However, you assist the patient with a question anyway. The patient asks you why their medications are so expensive. You quickly pull up their profile and inform them that their third-party insurance provider doesn't cover the medication. The patient becomes irate and demands you call the insurance company at once. While you're on the phone, patients start to line up at the pickup station and drive-through window. You inform the patient that the insurance provider doesn't cover brand name medications and that you would be happy to contact the prescriber to have them switch to a generic. The patient explodes and starts to take their frustrations at the insurance provider out on you. Someone with a low IQ, or EQ, might start to make the situation worse by trying to calm the patient in an ineffective manner, such as by ignoring their concerns or just outright dismissing them. However, someone with proper training and knowledge of emotional intelligence and self-awareness may handle the situation differently. They would most likely firmly explain to the patient that they would like to talk to them further about this and would like them to follow them to another area away from other patients so that they could potentially diffuse the situation. This in turn may be enough to settle the patient and allow them to think clearly, and if not, the pharmacist could offer them options such as to, of course, contact the prescriber for alternative options later in the day when the pharmacist has a moment, they're not so busy, or even the patient could do so and the prescriber could call in an alternative which may be covered and resolve the problem entirely. Finally, a few words of wisdom for those who will be coming after us. First off, treat others both above and below you with the respect they deserve. Secondly, be professional, not just in the workplace or at school, but in your private lives as well. It will make life a lot smoother and less ridden with potholes. And finally, follow your own path and don't let others tell you that your goals are out of reach. As long as you work towards them and believe you can succeed, then you will accomplish them with the utmost dignity and integrity.